Welcome to the Business Insider Podcast, where we interview the top business leaders in their respective industries. I'm excited to introduce you to today's special guest. We've got Dr. Dublon here, and we've got Artem. They are the co-founders of Assurance Orthopedics, and they specialize in elite concierge sports medicine. Guys, thanks for coming on the podcast today.
Thank you. Thank you for having us.
Absolutely, it's my pleasure. So as you guys know, I've got a bunch of questions lined up for you, and I'm sure our audience is wondering, specifically what you guys do and really what the major outcomes are for your customers and clients. So before the podcast, you guys have given me a kind of a brief rundown on what that looked like. If you wouldn't mind reiterating that to the audience, that'd be amazing.
Sure. My name's Jeremy. I'm a foot and ankle surgeon from the DMV, DC, Maryland, Virginia area, and I practice in Potomac, Maryland. Previously, I was a surgeon at Walter Reed and served as a surgeon for the previous president and current president of the United States. I met Artem at Harvard, and we developed Assurance Orthopedics. So Assurance Orthopedics is an elite sports medicine concierge platform, and the goal is to leverage AI and computer vision to bridge the gap between the point of injury and seeing the specialists. So for athletic patients, and especially with youth sports, the patients typically get injured, go to the local treatment facility, and then see a specialist some weeks later. We've found, and studies have demonstrated, that early intervention is clearly important to maintaining the peak athletic potential for that patient, whether they're pediatric or adult. So what we've designed is a platform leveraging AI and computer vision to connect that patient and customer to the specialist as soon as possible.
Makes perfect sense. And if you guys had to define your superpower or the unique skill or insight that really sets you guys apart in your space, what would it be and how does it shape your success?
Yeah, it's really going to come down to the patented computer vision and our AI engineer team. So we are able to build case-specific large language models. In this case, it's Assurance Orthopedics. So we've developed a large language model that is specific for sports medicine and orthopedics, but mainly focusing on sports medicine. What we do is we get daily input from the customers and patients over a broad base to allow the system to learn what inputs that we're giving to the patient result in the best outputs, meaning the lowest amount of pain, the quickest return recovery, and the most effective treatment. Also, when the patient is at the doctor, or if they're doing ancillary treatments at home, we're tracking whether or not those treatments are effective, utilizing computer vision and AI.
That's amazing, man. So just to be clear, this is like a software, correct? Just for anyone out in the audience who's kind of trying to understand how it works.
Correct. It's a software, but the platform is not just a software, right? The key and the linchpin of all this is that there's an elite physician involved, right? So when I say elite physician, it's not just a PA or somebody that is a resident or just a regular surgeon. These are sports medicine specific orthopedic surgeons who have relevant expertise in that area. So if you hurt your hand, you're talking to a hand doctor. If you hurt your foot, you're talking to a foot doctor. If you hurt your knee, you're talking to a knee doctor. We're not going to give you somebody that doesn't have the extreme relevant expertise in that area.
So it basically, let's say, I'm a person, I'm out in, I don't know, we'll say Denver, Colorado.
Nice.
Are these different doctors, are they all integrated into the software / app? Like, how does that work? Like, can I be anywhere in the country and get what I need?
You could be anywhere in the world and get guidance for what you need. So the key here is that we're helping to guide you to make the right decisions for you and your family or your athlete or your team or whatever to get the correct treatment as early as possible. So if we have a doctor in that area, because we do intend to get our own team doctors across the country.
Okay.
Right now, our doctors are mainly focused in Boston, DC, and New York. Really, those are where we have our folks, but it's a 24-hour service, right? So it's not just across the United States, it's across the world. So if you can get onto our system, pay the membership fee, you have an iPhone, soon to be Android, and internet connectivity, you can get in contact with one of our physicians anywhere in the world.
That's amazing, man. Now I'm curious, what kind of inspired the both of you to pursue your current paths? I mean, how'd you end up here?
Yeah, I'll give Artem a chance, but I got to tell you like why we created this. Okay. The
Okay,
whole
go for
reason we
it.
created this is the environment that we're in currently with health insurance. Every day, people are paying more and more and more to get less and less and less. That's one side of the coin. The other side of the coin that you don't ever hear is that the doctors are getting less and less and less. You might hear it when there's a Medicare cut because services are going to get cut. But when the doctor gets 3.5% less for the same surgery they did every year, plus 7% inflation, and then 3% increase for all the costs, you basically will break even in 10 years. So the writing is on the wall that the doctors need an
Yeah.
ancillary service, right? The patients aren't happy, the doctors aren't happy, something's got to give. And the rise of concierge medicine has been a response to that. So concierge medicine is not new, but in the orthopedic and specialty space, it is new simply because telemedicine, like video like this, wasn't enough, right? Most doctors want a physical exam. But if we couldn't get you a physical exam, but we could get you imaging and range of motion measurements through the phone, that would be a lot better than just a video.
Right. Okay. No, that makes
Mhm.
perfect sense. And I mean, I think we're seeing vast changes in every industry in the health and wellness field. I mean, the whole healthcare system and pharmaceutical companies and all of this stuff, it's getting to that point where we're starting to see major shifts in the public. Everyone's kind of fed up. Everyone's kind of sick of it.
Yep. So we wanted to utilize the latest technology to answer that question and multiple questions, but it's the same problem, right? So we're trying to help a lot of people here.
Yeah, that's amazing, man. What kind of time back to my question? I mean, how did you guys get to this point? I mean, what's kind of your background look like?
Yeah, perfect. So Artem did AI. He'll go.
Yeah, let me maybe go with it. Yeah, so my name's Artem. I'm AI engineer for 10 years already. I started my career as a machine learning engineer, working in different computer vision projects. Then I was one of the co-founding team at the startup called Prisma Labs. We did two really famous apps called Prisma and Lenza. I was chief R&D at the company, and then I became a CEO of the company. So we went from 0 to 150 million users. I took the company from zero revenues to profitability to acquisition. And at some point, I decided to quit. I joined Harvard Medical School as a researcher. We did several cool projects there. I have two patents, several publications in peer-reviewed journals, and this is the place where I met Jeremy. And this is how we all started with Assurance Orthopedics. And circling back to your question, why this particular field? For me, it was always my personal health issue. So I always have like some like foot pain when I'm running, and I was trying like how do I uh, fix this for myself using the tools that I know, the AI engineering, and not only for myself but also for the whole world.
That's amazing, man. Love that. Love that story. How about you, Jeremy?
I mean, I guess I got into this, the whole entrepreneurial aspect of healthcare. Um, I come from an entrepreneurial background. Um, my biggest concern was that people were getting injured, and this is a easily preventable problem, right? Like I would have kids, athletes. I have Division 1 athletes that play soccer, football, track and field, and I've seen that I could do a lot more if they just came to me sooner, right? Like this is an information gap. It's not a technology gap. It's not a resource gap. It's literally an education gap. And why can't we use technology to bridge those gaps? And I'm just a foot and ankle surgeon. So if the same thing's going on the foot and ankle, it's probably going on the knee, the hip, the shoulder, the elbow, the hand, right? And that's not even taking into account the pediatric aspect because pediatrics is a completely different management scheme, right? So that's kind of why I got into this. And obviously technology is a huge driver of why we decided to develop this. Without the technology, it doesn't work. It's simply just regular telemedicine. So that's why I decided to jump in now.
Now, kind of on that topic, obviously AI is changing the game in every industry. There's new agents coming out every day. How does the actual AI technology that you guys are using work?
Mhm, mhm. So essentially, our model is not just language model, it's a multimodal model. It means that it combines computer vision and the text at the same time. So essentially, we're trying to kind of build the like simple doctoral logic when the doctor uses his eyes to understand the shape and the deformities and the range of motion when performing physical exam, and at the same time talk to the patient, asking like relevant question, and then use both vision and text data to come up with a possible diagnosis and possible treatment protocols. And then this AI outputs gets validated by real physicians, edited if needed, and then it gets back to the patient.
That's awesome, man. Now, in a rapidly changing world, where do you guys actually see your industry going over the next 5 to 10 years?
Yeah, that's crazy because I guess to answer that question, we would have to define what is our industry, right? Is it just general healthcare? Is it orthopedics? Is it concierge? So from a concierge standpoint, that is going to explode. It's been exploding. It's gonna continue to explode. And the reason why is because we live in an on-demand society. People want access. People will pay for access. So I don't see concierge going anywhere. What I see happening with the private insurance is a revolution. The draw is too high for the resources that currently exist, right? They keep saying Medicare is going to crumble, Medicare is going to crumble. I mean, it's basic economics, right? You need the money from somewhere. So it currently has to change. How it's going to change, I don't know, but I'm pretty sure technology is going to have a huge play in the final outcome because that's the only possible way forward is, and Artem will say this, is AI and technology is going to allow people to not do the work, but just be overseers of the
10 times more efficient, essentially. And when Jeremy is talking about access, I would say it's immediate access. I want to get the response from physician not tomorrow, not in a week, not in 3 weeks. I want it now, like within the 5 minutes. And this is, I think, what it would be in several years using the AI technology, like super fast responses and super fast access.
Yeah, it's evolving so quickly, and obviously at this current time, you still have to give it an input. There has to be some sort of vocal or written response to actually make that AI think on its own. But it's amazing that in a couple years, it might not even need to do that. We already are seeing AI assistants popping out. You've got Meta glasses that's very baseline, doesn't really do much, but in a year's time, I mean, I think not even a year's time, I'd say maybe in 5 years, I think we'll see the average person having their own AI assistant on a daily basis. And kind of in the medical field too, it's like it's really going to change the game. And like you said, Jeremy, it's one of these things where people, some people are afraid of AI. It's going to take all these jobs. I see it as more, it's going to create new jobs and then allow people to be more efficient with AI. I mean, in our own businesses, it just saves us money, increases efficiencies, and allows us to be overseers of that AI. It's like your own version of your little employees. So I think
Yeah,
it's amazing.
so it's a work tool. Like this tool became a tool like 10 years ago. So right now we have a new tool like AI.
Now, you guys kind of touched on this a little bit earlier, but I just want to cement this. What do you guys think is the biggest problem in your industry? And at the end of the day, what are you doing to solve for that problem?
So I'm just going to assume that you mean the industry is healthcare as a whole, right? So the biggest problem is the lack of efficient utilization of resources, right? Things have become so expensive from simple insulin to just in my practice, the bandages have gone up 30%, right? If the bandages go up 30% and they're going to cut my income by 3.5% every year, where's the bottom line? I mean, where do we stop here? What at some point you close shop, and I'm not sure if you know this, Riley, but right now there's a revolution going on in private practice where private equity and venture capital have come in and bought up all these individual practices, right? And they're running it as a business. The product, the output is down because at the end of the day, they're not concerned with the patient's experience. They're concerned with the bottom line. So we've seen that is coming to a head very, very quickly. A lot of the doctors are leaving, starting their individual shop and starting practices that are one room, very, very small and very, very low overhead. It's a revolution that's coming. That's where I see this really going.
Yeah, man, it's not even much to say on it. It's so frustrating just thinking about the healthcare system. Like, I mean, I don't want to go down that rabbit hole too far, but just like to touch on my Lyme a little bit. Obviously my audience knows this, but for you guys, I spent many years very sick, couldn't figure out what was wrong, went to all of these doctors, spent all of this money, and it was like it feels like the system's designed to keep you sick. And that's kind of the way I feel. And it's not the doctor's fault. It's not the patient's fault. It's like you said beginning, it's a lack of information. People don't know where to go. People don't know what to do.
Correct. I mean, hopefully we can get this and our platform to a point where we spread out to other specialties, specifically like rheumatoid, infectious disease, where we can get people, look, you don't need to go to an endocrinologist, right, for certain things, and you really should be at an infectious disease doctor. That nuance right there, you probably have to go to medical school for 4 years and then residency just to understand that. But if we can simplify it for people and help guide them, that would save a lot of time and money, but more importantly, save them from getting worse off. That's the most important thing here is quality of life for the patient.
Right. Now on the entrepreneurial side of things, what advice would you guys give to someone that was looking to be an entrepreneur in the health and wellness space or, anything of that capacity?
Artem, I'll let you start and then I'll give you my
Okay.
super nugget.
Okay. um, I would say is that the most important thing is not just the it does it 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 sounds really like straightforward, but it is what it is. It's not like the idea, it's the execution. Because
Right.
yes, you can have like a great idea, but how would you make the unit economics work? How would you attract customers? Is it like who's your customer? Is it like the patient or the physician or the maybe insurance company? Like the three big pillars, right, of the healthcare. How would you attract this? How much does it cost to attract the customer? How much you make from this customer? You have to make it not just a little bit more than you actually spend to attract the customer, but preferably 2, 3, 4 times more than you spend. And even if you have like a great technology, you still have to really nail down all this unit economics aspect, and this would set you up for the really, really big growth. And I think this is most important thing.
Yeah, for sure.
All right, you ready?
I'm
So
ready.
for me, this is like the not as important one, but number one, like it's a journey. You're going to fail. Like the failing part is the education part. And if you don't understand that the failing part is the part where you learn, then you're going to be frustrated learning. And the whole point is to learn as fast as possible. So in a nutshell, you have to fail as fast as possible, learn from it, and keep failing until you can't fail anymore. That's really it. And to that end, you got to make stuff that people either A, want or need. So the biggest problem I've seen with entrepreneurs and businesses, because I consult with other people like implant companies, is they build a product and then they go look for the problem.
Right.
That is the hardest thing to do. Go find the problem or go find where the product doesn't exist and then build that. And it's a lot easier that way.
Yeah, no, that's a very good insight. And guys, for any of our viewers out there that would like to connect or collaborate on a business side, or maybe for a customer or a person that is looking to check out the software you guys have created, what would be the best way for these people to do so?
I guess just go to our website, assuranceorthopedics.com, and try our service.
Perfect, guys. And then on the entrepreneurial side, if there are any guys out there that, are very interested in collaborating with you guys or connecting, what would be the best way for them to do that?
I guess LinkedIn, maybe. Yeah. Just write us on LinkedIn. It's the same names. Just search on LinkedIn, and that's it.
Okay, awesome, guys. Well, I'm gonna link all of their stuff in the description. So whether you want to reach out to these guys, to connect and collaborate on a business side, or you are an individual or person that is looking to actually dial in your health and get the help you need, go check these guys out. They've really created something amazing here, and it's going to be exploding in the next year or so. So definitely get on it now. And guys, thank you so much for coming on the podcast today. It was a pleasure.
Thank you,
Thank
Ryan.
you. Thank you so much.
Absolutely, my pleasure.